over the last sort of generation, we've not trained globally enough doctors, nurses, allied health professionals to meet the demands of the growing population. And as a consequence, it's simple supply and demand. Doctors, nurses, ancillary staff, AHP staff, they can go anywhere in the globe. And so we are increasingly in a worldwide market to try and attract staff. Now, Gibraltar's always been very attractive. We've not had difficulties in terms of recruitment, but even we in Gibraltar are finding problems going forward.
There are gaps.
There are gaps in particularly some of the specialist nurses, for instance, so diabetes and some of the other specialist nursing areas. So what's really important for the future is two things. One, that we work very closely with the likes of the University of Gibraltar to develop and train our own staff. But secondly, we look at different models of care. So if you look at diabetes as an example, we can look at specialist nurses. It's not just about doctors, but it's also about other groups of staff who can support, so allied health professionals who can support that type of care. So we are looking really innovatively for the future. We are trying to use our staffing in a different way.
It's an issue in certain discrete services. So, for example, the diabetes specialist nurse is one that we've had issues for the past 4 or 5 years. We've had the vacancies, we've had the complement, we've tried to recruit, and it's an issue that we are struggling with. So what we're trying to do is look at alternative means of training up nurses so that we have the complement in Gibraltar, homegrown, as it were.
But what you've sensed tonight is the other side of the coin, the people that are obviously going through the service and realizing that there is a gap there.
Yes, and we've sensed it tonight, but it's something that it's one of the common elements that we frequently get. So we frequently meet with the diabetes, or we've met with the Diabetes Society. We know that that's an issue. I've mentioned to you just before, my mother's diabetic, so I'm fully aware that we do need to beef up that service. But like I said, we've got the funding there, we've got the complement there. We are just in the process of recruiting nurses, and we have put the advert out some 4 or 5 times, but we are struggling to recruit diabetes specialist nurses.